Good evening, everyone. Welcome to another Medical Mondays with Dr. O. What a great day, a great season. And I feel so blessed that we're here with all that is going on around us, which is why we're here to, learn more so that as we're going through this planet, that we're going through it in good health, in excellent health. Dr. Toyin Okpesomi. I'm a family practitioner, HIV specialist, and I treat addictions in Maryland. I enjoy medical information and the sharing of knowledge. I love to learn, like most of us are on this platform. So tonight, we're going to learn from one of our gurus, gentle but mighty, Dr. Oluwole Ajagbe, who has been a leader in the industry for many years. I'll let him complete his own introductions. If you remember, people on this platform have decided people should introduce themselves so they can do the needful. Nobody can know you better than you. So, Dr. Jagbe, the floor is yours, sir, to talk to us about that topic that got me into trouble. People saw the title of our talk tonight, and I got a few text messages. How does your health smell? Good or bad? The floor is yours, Dr. Jagwisa. Welcome.
Good evening. Good evening, everyone. It's nice to be back, to see you all, even though I can't scroll through everybody while I'm making presentations. But I know everyone who is participating tonight has been very faithful in participating every Monday. We've been enjoying together all the diverse topics to keep us healthy for a brighter future. Yes, I'm a dentist, but I'm a specialist in some areas of dentistry, uh, oral pathology, oral medicine, forensic, uh, sleep medicine, and quite a few other areas of dentistry. But tonight, we're not going to go into details of so many things, but we're going to just remind ourselves about some of the things that confronts all of us at one point or another. We, uh, I don't think there's any one of us who has not experienced, a bout of bad breath, albeit it could be just temporary. For some people, it's a long, protracted experience, which makes life very difficult for them, among others. Um, the title of the topic tonight is kind of catchy. How does your health smell? So, for those people who say, "Wow, is it health or your mouth? Which one is this? Is it your health that smells or your breath?" Uh, the thoughtfulness of the topic shows to you that there are many causes of bad breath. When we talk about bad breath, we are talking about the kind of odor that somebody perceives when we come in close contact with with somebody else. If you're talking to somebody within 3 feet distance, sometimes you have to cover your nose if it's somebody with a very offensive breath odor, and then that accounts for what any kind of breath that makes somebody who is perceiving the odor to really want to run or cover their nose while they listen patiently to the individual constitutes what we call halitosis. Halitosis is a big word, but it only means bad breath. It is not just every bad breath that can be classified as real halitosis. Because if you ate something that is very rich in onions, for instance, or garlic, or you just ate tuna sandwich, for a period of time, your breath will smell. It kind of tells people what kind of lunch you just had, or maybe the dinner that you just had. However, there are other conditions that make this kind of bad breath or bad oral odors to linger, for extended period of time. I'm going to go about this just kind of to help us. If we look at our face in the mirror, let's walk our way from the top of our head down to our chin, and we can see how the breath comes into the picture. Uh, if somebody has not been taking their bath regularly, if you hold their head close to your nose, you can smell something. Uh, Particularly if the person sweats a lot, has a very oily scalp and oily skin, and there's so much dirt in the hair, definitely the scalp will smell. So if somebody comes close to you, even though they haven't opened their mouth, you can perceive some offensive odor. It does not mean that they have bad breath until they open their mouth or they breathe close to you without even opening their mouth. Through their nose, you can smell certain offensive odor. That will, in that situation, if it's coming from external, it will not be classified as bad breath. Now, if the hair is clean, the face is clean, but when somebody comes close to you, they are breathing close to you, the breath that you are smelling from them is very offensive. The chances are that the problem is not coming from the mouth primarily, it's coming from the respiratory tract. Respiratory tract, I hope that is not too big a word. The respiratory tract means the area of our body where air goes in through the nose into our lungs and comes back out when we breathe out. That constitutes the respiratory system. The respiratory system starts from the tip of our nose. The holes on either side of the midline, the left nostril and the right nostril, they are generally the two cavities have very fine hairs. Every one of us has it, whether you're a male or female. However, as you know, by gender distribution, you have more coarse hairs in the male nostrils as we get older. Now, dirt can trap, because the hairs are helping to filter the air that goes through the nostrils into the lungs. Now, if there's many musty, whatever, thing in the air that the individual is breathing in, the hair will filter any particles, and those particles can carry some odors with them. Those will be very superficial, will be very much on the outside of the nose. Now, if the air passes beyond the hairs and then goes to where the mucosa is the lining of the nose is very soft, very moist, and even though they are moist, they are not runny, they are just moist. The air that we breathe becomes moisturized in that part of the nose. Over time, the air will dry up the lining, and sometimes the mucus secretion in that area will also dry up. When the mucus dries up, it becomes stinky. It's worse in people who have postnasal dripping. Those who have allergies and they're constantly having drippings in the back of their nose, sometimes those drippings will become dry and become hard. And actually, some can be very hard, like you think there's like tiny pebbles. If you are able to bring that thing out that is so hard, it is dried mucus, it smells so bad. If you ever saw anybody that coughs something up like that, it is not very pleasant smell. So that can constitute a bad source, I mean, a source of bad breath for somebody who is constantly having allergies. Now, we are still talking about the airway. So past that, the back of the nose, going on into the larynx, which is where what we call the voice box, right in the middle, right there. Sometimes people can have, infection of that area, and there'll be a lot of secretion in that area that actually sometimes become very thick. And not just being thick, they become dry and they become offensive as the individual breathes out. When somebody breathes out, the air coming through from the lungs carries the odor from that general area, and anyone who is close to the individual breathing can perceive that offensive odor. Now, still talking about airway, we can go further down. There is the area of the airway that is called the trachea, and then the branches are called bronchi. The bronchi became finer and they become bronchioles, and any of those branches can become inflamed. And as they get inflamed, sometimes if it is infected, the bacteria will cause the destruction of the tissue and release of pus. When you have pussy secretion in that area and you bring it out as part of your breath when somebody is breathing out, the smell will be of a putrefying flesh. Pretty much like what you get when somebody forgets raw meat in the trunk of their car for about 4 days, and then it's just snow, something stinks, something doesn't smell right. And they go into their trunk and say, oh my gosh, I forgot the beef. Where is the beef? You remember where the beef is now, it's in the trunk. The stench will get you. That kind of stench, you get it from people who have bronchiectasis. Those who have, that the breathing apparatus is broken down so that there are spaces where mucus collects. The mucus cannot be easily, coughed out. And so because they are not being coughed out easily, they become decomposed, they become very offensive as the people breathe through their nose. So that, just thinking about the airway alone, from the nose to the lungs, all the way to the base of the lungs, you can get bad breath coming from that. Now, let's move on down south to the mouth. Let's say everything is fine. The scalp is fine. The hair is beautiful, smelling nice. The nostrils, the airway is clear. But the person has continuous sinus problems. They have continuous sinus problems, and the two nostrils are blocked, either completely or partially. If they are blocked partially, they can still, breathe through the nose, but it's very hard and labored. Most of the time, they will default to opening their mouth because they are under distress. So when they in that condition, they have to open their mouth. When they open their mouth, they breathe through the mouth. Now, if the sinus is infected and there is pus accumulation in the sinus, at some point when it gets to where the opening is, every sinus has an opening. We call them ostia. When the fluid gets to that level, it technically just flows out into the nasal cavity. When it flows out into the nasal cavity, it automatically causes bad breath. You can see pus in the nose. The pus can dry up. When the pus, whether it dries up or it doesn't dry up, as the person breathes in and out, there will be bad odor coming from the nose because of the infected sinus. Now, Let's finish with airway and go down to the mouth. There are many causes for bad breath in the mouth, but let's start with the commonest one. The commonest one is when you sleep at night and you wake up in the morning, you didn't brush your teeth before you went to sleep, and you ate something like a sandwich or pasta or some kind of carbohydrate, or you finish your dinner with dessert, dessert that is very rich in carbohydrate, refined carbohydrate. Well, you have just created an avenue or a space for bacteria to feast all night long because you just gave them what they love. They love carbohydrate, they love refined carbohydrates in particular. And so by the time you wake up in the morning, your breath is bound to be offensive. Well, we call it morning breath because it's temporary. If you go back into your bathroom and spend some time in your bathroom, chances are that you're going to eradicate that temporary bad breath. But then by the time you finish brushing and you are all smiling and everything is smelling good, and then you have breakfast. And your breakfast is, call it anything, whatever breakfast, and then you finalize it with a cup of coffee. Then you love cream and sugar. You load it all up, and then between you finishing your coffee in the car and get it to work, and if you are not in a place where you talk a lot, the chance that your mouth, the sugar leftover that you have in your mouth will begin to ferment. And the bacteria will have a field day, they will be enjoying themselves and causing the breaking down of the sugar. There will be some kind of release of gases in your mouth, which will not be very pleasant. So that also is temporary because you can go to your break room or go to the restroom and brush your mouth, and that will be taken care of. There are some breaths that are so offensive that you cannot get rid just by brushing. Those are the ones that really need attention from the professionals. The professional, the primary caregiver in this case will be a dentist. Occasionally, you have to see an ENT specialist if it has something to do with the floor of the nose as well as the roof of the mouth, or connected if there's a communication. That, in most cases, will be seen by an ENT specialist. Now, we are now in the mouth proper. The first thing we can consider as part of the contributory factor to a long-term bad breath is mouth breathing. Mouth breathing is bad news. We've seen it from previous presentations. Mouth breathing affects sleep. Mouth breathing affects well-being while you are awake or while you are sleeping. Whichever way you are, if you are breathing through your mouth, you are not a healthy person. I mean, there is no way you can rationalize it. You're not healthy. And you need it. You need attention ASAP. Because if you can't sleep at night, it's going to affect everything. So your daytime wakefulness is going to be affected. You'll be doing all kinds of things to stay awake, but it's not going to be positive. So until the primary cause of sleeplessness or obstructive sleep apnea or any other kind of abnormal sleep, breathing condition is taken care of, you will not be healthy. Now, to become a mouth breather means your nostrils are blocked. Whether they are partially blocked or completely blocked on both sides, it means you must get air into your lungs at all costs. And to get it means you have to open your mouth. Opening your mouth to breathe is the most inefficient way to breathe. for so many reasons. Because when you breathe through your mouth, you cannot breathe deeply. You breathe shallow, and then you have frequent breaths compared to if you are breathing through your nose under normal circumstances. So a mouth breather needs help ASAP, because if a mouth breather is not helped, it's going to cause the mouth to dry up. Because as you breathe through your mouth, the air is dry. The air takes the moisture in your mouth and takes it into your lungs, but is not purifying the air before going into your lungs. While the air is drying the mouth, the teeth become dried up. When the teeth dry up, it means debris and everything, plaque becomes more adherent to the teeth. So somebody who is a mouth breather will have increased accumulation of plaque. The plaque is what we get on our teeth when we wake up in the morning before we brush. If you run your nail, the tip of your nail across your teeth, you can see something that looks like cream cheese that comes on your teeth. That you can easily brush off. If you are a mouth breather and you don't brush your teeth regularly, just by not brushing your teeth regularly and having a dry environment in your mouth will smell. The smell is not going to be pleasant, and it's going to get worse because your tongue has very tiny hairs. Those tiny hairs on your tongue that makes the tongue look rough, they trap food debris, they trap all kinds of things. Unless you clean the tongue, bacteria have places where they can actually grow and cause putrefaction of dead cells as well as leftover food that's on the tongue. If you're a mouth breather, the chances are that your tonsils and your adenoids will become enlarged. When your tonsils and your adenoids are enlarged, they will eventually, it says they are enlarged because they are infected. Initially, they are inflamed, but eventually they become infected. And whenever you have infection of soft tissue, you are going to end up with pus. When you have peritonsillar abscess, that can leak into the mouth. The presence of pus in the mouth doesn't smell good. And with dry mouth, because the person is still a mouth breather, it makes the breath even worse. So when you know of anyone or you have a patient who is a mouth breather, they need all the help they can get ASAP. Now, so we can get bad breath from, mouth breathing. Another cause of bad breath is decay, cavity. If anybody has a cavity in their tooth, I don't care where the cavity is, whether it's in the front or in the back. If you've had a cavity for some time, I want to challenge you tonight. If you don't want to do anything about it, I want to challenge you tonight. Get a toothpick, just simple toothpick, and go inside that cavity where you have the cavity you've been ignoring. Stir it a little bit and bring the toothpick out and put it close to your nose. Maybe because you don't know how offensive that smell is the reason why you haven't done anything about that cavity. Well, if you smell it, if you have ever gone to pit latrine, a pit latrine like what we used to use in Africa, in Nigeria, the smell is close to what you get from a pit latrine. Because the bacteria are doing exactly what they do to leftover food inside our guts. So if you leave that cavity unattended, it's not going to heal itself. It's going to get worse. If something that needs filling, you leave it for so long, the feeling is too big now that no feeling can stay inside, then you move on to the next stage, which means they may have to do a root canal if you still want to keep that tooth. But when you do all of that, the tooth becomes weaker and weaker. Eventually, the tooth will become like a shell that you can actually crumble by crushing them together. You buy something that you don't even think, excuse me, that you don't even think is hard, and boom, the tooth cracks. And I say, boy, I was only eating bread. Wow, what happened to my tooth? And they want to blame it on so many people. It is the household enemy that caused it. It's the witch next door that made it happen. It's not the witch. Oh. If you have cavity and you have not done anything about it, well, please make some effort. Let it be checked out. It may just need simple filling, and that will take care of the problem for you. But if it needs extraction, don't wait until the infection is so bad that you have to do major surgery to get the tooth out. As you move beyond simple treatment, it becomes more expensive. So, uh, but what we are focusing on today is the bad breath that is coming from that. So, if you smell somebody's breath and it smells like pit latrine, know that they have decayed teeth in their mouth. And there's nothing they can do about it. They can use mouthwash, they can use Listerine, they can use Listamine, they can use the most expensive mouthwash. As soon as the smell of the mouthwash goes away, the stench comes back. That pit latrine odor must come back until that cavity is fixed. Now, another cause of bad breath from the mouth is when you have gum infection or gum disease because you have not been taking care of your oral health. You've not been brushing, you've not been using chewing stick, you've not done anything to your teeth. And your gums, because of the bacterial accumulation in the plaque, the gums are soft tissue, they become easily infected. While the teeth are getting cavity, the gums are getting infected. And when the gums are infected, guess what is going to happen? The gums are going to bleed. They're going to have pus. That is what some people call pyorrhea. When you say, oh, my dentist said I have pyorrhea. Well, pyorrhea just means you have pus coming from your gums. So if you have gum that is bleeding and has pus coming from it, it cannot smell pleasant. I don't care who you want to kiss in the dark. Well, that person is going to just get repelled by just coming close to you and say, wow, oh, let's skip that. Let's skip this one. Let's move on to something else. So bad breath coming from the gums can be taken care of very easily by improving your oral health. How do you improve your oral health? It's very simple. You can do any mechanical means to remove the plaque. But if you have not brushed your teeth for 3 weeks and you now have calculus, which we call tartar buildup, your toothbrush may not clean it. You may have to go, you have to go in to get help. Unless you want to use your pen knife or your table knife or your steak knife to give yourself a deep cleaning. But you know what's going to happen? You're going to go home, you're going to be having bleeding gum and torn gum all over the place. But if you need professional help, there are dentists who will see you first and maybe ask the dental hygienist to give you a thorough cleaning. Another cause of a bad breath coming from the mouth uh, comes from when your gum is already bad. Your teeth are already loose, but they have not gone off completely. Because of the way they are hanging by the thread in your mouth, they just wobbly, wobbly, wobbly. You can't chew with them. And every time you cannot brush them because you're afraid the teeth will fly up. Because if you brush it and you brush too vigorously, the tooth will become extracted just by you trying to clean it. Most people don't want to do that. They don't want to lose their teeth for any reason. So they keep it there, even though the calculus, the tartar buildup keeps on getting bigger and bigger. And so these are the kind of things that will bring real bad breath coming from the mouth. Another thing that causes bad breath from the mouth is the back of the tongue. We divide the tongue into three parts. We say the anterior 2/3 and the posterior 1/3. The posterior 1/3 has some kind of structure that we call circumvallate papillae. The secretion there is very sticky and mucoid, very thick. And so when you eat anything, the last part of your tongue that catches the food or whatever it is you are eating is the posterior 1/3 of your tongue. If you don't clean that area, which is very difficult because when you reach out to clean that place, most people will retch. They will gag, because as you go further back, you are stimulating the soft palate as well as the uvula, and that causes you to retch and to gag. And most people don't clean that area. So bad breath will come there. You can say, yeah, I brush my teeth twice every day. But then they still tell you your breath stinks. So if you address all of these things in a preventive fashion, your breath will always remain, if not perfect, will be close to being perfect. All right? Another cause for bad breath from the mouth is if you have appliances in your mouth. Let's say you are wearing dentures. You have missing teeth. They've given you a partial denture. You can remove it. You can put it back yourself. You can remove it. You can put it back yourself. When you remove it, it's supposed to be for you to wash, to clean it, so that when you put it back, nothing, no dirt, no remnant of food is under the denture between the denture fitting surface and your gums. That is the reason why you remove it and clean it and put it back in. Some people do not know how to clean their dentures. So they take it out, they just rinse it, they wiggle, 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 shake it, shake it, shake it, put it back in their mouth. That's it. So a denture, even though it's made from plastic or a combination of plastic and metal, they don't need to have any stain on them. They should not have any calculus on them. If you're taking care of them normally, they should be like your clean teeth should be every time. But if somebody has dentures and they do not take care of it, whether it is partial denture or complete denture for those who have no teeth at all, if you don't clean them regularly and disinfect them regularly, the pores, they have very tiny holes that you cannot see with your naked eye. But when you use magnifying lens or you use microscope, you can see how big those holes can be. Those holes allow food debris and bacteria decomposition to go on in the denture, even when it's not in the mouth. So the denture needs to be cleaned properly and soaked in disinfecting agents. I would choose to use hydrogen peroxide for a few minutes before you put it back in your mouth. You soak it there, rinse it, put it back in your mouth. Every form of anaerobic agent will be at least reduced if they are not completely eliminated. All right. So I hope everybody is following. We are covering the area of the mouth. Now, if you have a bridge is a device or appliance that you cannot remove by yourself. It can be removed, but it's a dentist who has to remove it for you. If you have to take it off, it's because something has failed and they have to remove it to repair it or to replace it with another one. Usually, if you have a bridge, there's a gap between the replacement tooth and the ridge and the gum tissue. That gap needs to be cleaned regularly by what we call a superfloss. The superfloss will be threaded from one side, from the cheek side into the tongue side, and you pull it and you clean under the bridge thoroughly. Because if you don't, if you push the plaque against the teeth that are holding the bridge in place, over time, your gum will recede around those abutment teeth and the root will begin to rot. Root decay causes many people to lose their bridge. Now, imagine if you have spent about $10,000 for your bridge and you are losing it because you cannot even clean your own teeth. Your investment is just gone down the drain. So, just to recap, everything that causes bad breath from the mouth can be easily prevented. So we need to bear this in mind. We cannot overemphasize some of these things because to be healthy in overall health means your mouth has to be healthy. If your mouth is unhealthy, the chances are that you have unhealthy systemic health. If your heart is not causing the problem, I mean, it's not reflecting the problem right now, over time there will be problem. So we have seen the link between chronic periodontitis, which is the chronic gum infection, and heart problem. We have seen the connection with kidney problems. We've seen it with meningitis. We've seen it connected to almost every system of the body is affected by poor oral hygiene. I will categorize every other causes that come through the mouth as systemic causes of bad breath. When somebody has problem with their stomach, whether they are constantly regurgitating that we call reflux, or they have, a situation where the food is fermenting in their stomach and they are belching and they are burping very bad, offensive gases from their guts. It's coming from the inside, but it's coming through the mouth. Sometimes people who have, not sometimes, people who have uncontrolled diabetes, those who we say that have ketoacidosis, will often have the breath that smells like fruit. When you smell somebody's breath that smells like fruit, you know they have some problem with their sugar and it's not controlled. Now, there are other conditions that can cause bad breath coming from within. Dry mouth, which may be as a result of salivary gland problem or from side effects of medications, will also cause bad breath. So I will stop at this point and I leave everybody to, the room for questions so that we can further discuss as questions arise. Thank you for the time to share with you, and it's time to see you again.
Thank you so much, Dr. Ajagbe. That was excellent. A lot of us may not appreciate what just happened here, but when you have a subject like is just discussed, it's very difficult to put it into plain English terms. These terms are hard to interpret, and I have seen Dr. Ajagbe evolve on this platform because when we sit in the medical forum, it's a different ball game. That's easy to present because it's the language we learn it in, it flows. But when you're presenting to a general audience, you've got to speak English. And the man just did that. Thank you, sir. We appreciate you. Thank you.
You're very welcome.
Yes.
And
thank you so much, sir.
Yes, thank you.
You're welcome. Yeah.
Thank you, sir.
You're very welcome. Thank you.
See, what Dr. Ajagbe just did was he scratched the surface. A lot of us also may not know that oral health actually directly, like he said, affects the heart. can cause meningitis, it can cause a lot of diseases in the body. That is why maintaining oral health is important. And he went step by step, hey, oh my gosh, to go over different scenarios where one has to pay attention to oneself and correct. The purpose of this forum is to disseminate, correct, congent medical information and, to help us prevent disease entities. And if there are ones that have occurred, so that we can know how to intervene without establishing physician-patient relationship. But we're here to answer questions, to guide the best we can without that relationship. So I have some questions, Dr. Ajagbe. I have some of my own, but I'm going to leave it. If I have time to ask it, I will. But, a comment was made that many patients breathe through their mouth due to a corpulent state.
Due to what? I'm sorry. Due to?
You know what, Dr. Craig? You do this to me all the time, so I will put you on the spot all the time. Kindly unmute and put your questions together or your comments and ask them. Thank you, Dr. Craig.
Dr. Ajagbe, a fantastic presentation. You tried to simplify a very, very significant topic, and I know it's very difficult trying to break it down the way you did, but you did a very, very good job. You've mentioned a couple of things. One of the things you spoke to was mouth breathing, and you are 100% correct, of course, in that it is a significantly serious state. And it usually speaks to other conditions. The mouth breathing is the effect of something else going on, and it needs to be handled right away. And that could be, greater medical issues, which we haven't even, which we can't really deal with right now. But also, you mentioned apnea. Now, apnea, as I know, is a significantly dangerous state, and people don't understand it sometimes, how dangerous it is, because there have been patients who have, who with a high degree of apnea have unfortunately succumbed. They've lost their breath at this point. Oral health requires the specialty of someone like yourself, other than us doing boric acid or things like that, cleaning. And as much as we try to bring forth some level of cleanliness, oral cleanliness, we are always at a miss in terms of being able to do it effectively. There are simple tools that we use, toothbrush, mouthwash, picks, etc. Is there anything in particular that you would say to someone? And now let's also speak to reality. A lot of people don't have dental insurance, so they can't see someone like you. We can't go as quick as we can. If I were to tell you a story in terms of my own thing, I had to think twice in terms of whether I was going to enjoy myself, my living, or pay the dentist and sit and have a good set of teeth, whatever. But is there anything that comes to mind in a very simplistic way, which can aid those of us who are, quote, truly struggling to have a better oral degree at this point?
Dr. Before you answer that, I just want to buttress it with the fact that, Dr. Craig, even with insurance, dental health is difficult to pay for, because insurance will pay for basic things like cleaning most of the time, and the rest of it is not covered. And dental care costs thousands of dollars. Thank you for your question, because that's why we have this platform, so that everyone can be reached. Thank you. Go ahead, Dr. Ajagbe, sir.
Thanks, Bill. Let me tell you simple. I've said this at some point in the past. Before you clean anything, you have to ask yourself, what are you cleaning? Right? If you want to clean a car, you're not going to use a scorer that you use to clean the grill. You're not going to use the same brush to clean the car. I mean, your expensive car, using the metal brush to brush your car would not be appropriate. Your teeth are more valuable than the best china that your money can buy. Unfortunately, because ignorance of the value of what you have makes you to neglect those valuable stuff that you have. And when it's too late, you run around to try to get it. I'm not saying you, Bill, I'm just saying generally. Um, to simplify everything, I use expensive china as example. Let's say you have one of the best, most expensive china that you bought from Tiffany and Co. One dish costs $2,000, just one plate, $2,000. And you use it to serve cheesecake. Well, your cheesecake maybe $5 your slice, but you use a $2,000 plate to eat it to enjoy it because that's affluence, right? There's nothing wrong with that. Now, tell me, how do you clean that plate? Now, are you going to use a scorer? Are you going to use Brillo? Are you going to use sand? What are you going to use to clean off simple cream cheesecake that you have right on your distance? That is the problem that we face. People are spending hundreds of dollars to buy toothbrushes to clean up what amounts to cream cheese from their teeth. Does that make sense? I don't think it makes sense. But if as a dentist, if I'm making a killing selling Sonicare to you at the rate of for every Christmas, you want to buy something good, you want to buy a gift for your loved ones, you come to my office, you order 10 Sonicare. I just made for how much did I make from you? $2,000 profit. But you still come back to me with cavity. You still come back to me with gum problem. And you have still not used that Sonicare to your own advantage. You just wasted your investment. That's as simple as that. You're cleaning, generally, all you are cleaning is as thin as cream cheese on your teeth. Every morning, if you do it every morning, there will be no accumulation more than just a thin layer of cream cheese on your teeth. So why do you labor over that? And I shared this before that you can use your washcloth. You see how simple that can be? Your clean washcloth, you can use it to clean your teeth and you'll be as shiny and smooth and clean as ever. Because you know what you are cleaning from your teeth. Are you following me?
Yes, I am.
The simplest way to go about it is know what you are cleaning. If you already have tartar buildup on your teeth, you need help. You got to go somewhere, get it clean. I made a joke of it that if you want to use pen knife, you can try or what do you call it? Swiss Army knife that can do everything. You can use it to clean your teeth. Fine. If you don't get cut gums, you don't get too much bleeding going on there, that's fine. But simple, I don't have any interest in the toothbrush manufacturing company. I don't have any financial incentive to recommend anything to you as being the best.
However, if you know what you are cleaning, use any technique that you can use to clean it off. In Africa, we use chewing stick. If you have chewing stick, you chew it properly, you will have teeth, sound, strong, and also clean. Incidentally, if you don't think of this, we found that the Western diet is the reason most people have impacted wisdom teeth. If you grew up in Africa and you chew stick, you chew whatever you call it, sugar cane regularly, and all these things that are fibrous, your teeth will, your jawbone will grow properly, and your teeth will come out, and you will have no impaction. But most importantly, anything that you can use to clean off plaque from your teeth, use it.
Mm-hmm.
Thank you so much.
Mm-hmm.
I learned a big question, a big lesson from Dr.
Sorry, I
Ajagbe.
can't. What?
Can you hear me?
Okay, now I'm hearing you now. Go ahead. Mm-hmm.
Okay. I said I learned a big lesson from you a few years ago about toothbrushes. I was brought up to buy the hard toothbrushes. You remember that? I believe that you have to scrub your teeth and use that Colgate. It has to be Colgate toothpaste. And Colgate. And you have to scrub it. So, but it was never comfortable. That was how we were raised. And I learned from Dr. Ajagbe, all I needed and now use is the soft bristles. You have the soft, the medium,
and the hard.
The soft ones is all we need. And, just go up and down, up and down, up and I love to learn. So I learned that from them on how to brush properly. I also learned how to use the super floss. I just did that recently. So those are tools that, are simple to use and, help us out. Thank you so much, sir. Dr. Akitonde wrote here, oh, somebody raised their hand. So for people who are, first timers here today, or, and you don't know, if you raise your hand, you have priority to ask your question. But if you put your question in the chat box, it's still going to be answered. Trust me. It's just that it will be after those who raise their hands. So I have here one of our amazing sisters who you'll be hearing from soon, Mrs. Tokumbo Atewo Logun. You have your hand raised, kindly unmute and thank you.
Good evening, everyone. Thank you so much, Dr. Ajagbe, for giving us a wonderful, I won't say lecture, but a lot of information in oral care. I was just kind of curious, and for me as a nurse, I wanted to find out how often should we be changing our toothbrushes? How often should we change it? Every month? Should we change, especially after having a cold? Because somebody told me after a cold, you're not supposed to use the same toothbrush anymore. You're supposed to toss it and get a new one, or on a regular basis. What would you suggest, sir? Thank you.
Thank you very much. That's a very insightful question. The simple answer is whenever you look at your toothbrush and it's already spreading like this.
Okay, sir.
If the bristles was like this when you bought them and they are already like this.
Okay,
can you
sir.
see me?
Yes, I can see you, sir.
when you see your bristles like this, you
Yes,
know
sir.
it's time.
Okay, sir.
You know it's time to change them. Whether it is 1 week, 2 weeks, or 3 months.
All right,
If
sir.
you use your toothbrush properly, most of the time you can use 4 toothbrushes a year.
Okay.
So you change your toothbrush once every 3 months. If you brush properly and your toothbrush bristles don't go like this very quickly. If they go like this, it's no longer working.
Thank you, sir.
What about after a cold? Did you have any?
Okay. All right. So let's say you just had a cold.
Yeah.
And you've been using this brush and the bristles are still like this. all right? And you are dealing, you're kind of debating within yourself. Hey, this is brand new toothbrush. Should I toss it so I can get another one? I just took it last week. What am I going to do? Well, it's simple. There is, as simple as I can make it. There is no germs that comes in your mouth that will survive hydrogen peroxide. So if you don't want to throw away your toothbrush, just soak it in hydrogen peroxide. Leave it for 1 hour if you care. Change it as many times as you want. The germs are going to be gone. There's nothing. It doesn't come back like that. So I would not toss my toothbrush because I had a cold if it's a brand new toothbrush. I won't toss it. I will just clean it out, disinfect it, and use it again.
And if it's not crooked yet. So
and if it's already spread eagle,
then that's not, then we don't debate that. So Dr. Craig, go ahead, sir.
The question I have, actually, you just mentioned it, hydrogen peroxide. I read somewhere, and I read recently, that the hydrogen peroxide mixed with baking soda is an extraordinary whitener. But the recommendation is that we do not overuse that kind of an item because it does erode the enamel at this point in time. And while it's serving us, we need to be very, very careful with it. Just in terms of your thoughts about that, sir.
Let me tell you, apart from my professional experience, my own personal experience, this is my 15th year of only using baking soda and hydrogen peroxide. 15th year, right? My teeth has not worn faster than before 15 years ago. So I don't know where see, there's some things with superficial learning and superficial knowledge. Every time you apply baking soda to liquid, it dissolves. Initially, it will still be there, gritty, but as long as you keep it with an aqueous solution, that is watery solution, it must dissolve. So it's not like you're using silica particles or sand to brush your teeth. So I've been using baking soda and hydrogen peroxide for the past 15 years.
So question, Dr. Ajagbe. I know that Colgate has baking soda and hydrogen peroxide and peroxide. Is that okay for us to use as a toothbrush, a toothpaste?
Okay. I can tell you a little bit of genesis of that product. I used to be in charge of the research, for National Dental Association in America. And I used to take my students from Howard University to Piscataway, which is the headquarters, the world headquarters for Colgate-Palmolive. One of those years, I challenged the veracity of the expensive toothpaste to simple baking soda and hydrogen peroxide. And it was the basis of a research that two of my students presented at Colgate-Palmolive. And the rest is history. So now it's part of their knowledge base. And so now they're using it as part of the product. And the other products have been growing from that whole area. The first company that began the baking soda and hydrogen peroxide was Arm & Hammer. Arm & Hammer has been in the business of baking soda for maybe 100 years. And they are the ones, by simple understanding, if you understand the basis of what we are talking about, you will not be struggling to understand it. Baking soda is a base, is an alkali. Because it's an alkali, anywhere there is acidity, it must neutralize it. Every bad condition in the mouth is caused by acidity, acid environment. And so when you use baking soda, you just immediately you introduce sodium bicarbonate, which we call baking soda. You neutralize that acidity instantly as soon as you contact it with baking soda. If you have bad gum infection that nothing has helped, you've gone to the gum surgery, they've given you Peridex, they've given you all kinds of antibiotics, but you still have this bad situation going. I challenge you. Take $3, go buy baking soda, one small box of baking soda and one bottle of hydrogen peroxide. Within 1 week of using that, your gum problem will subside. I challenge you. And if you don't get any solution, call me and let me know. Maybe there's something else going on there. But if it is simple chronic gum disease and you use baking soda and hydrogen peroxide, it must go.
Thank you, sir.
Now, if you have a difficult bad breath that's coming from your teeth and your gums, the only thing that can get rid of it substantially for you is baking soda and hydrogen peroxide. Now, some people will be questioning, how long can you use hydrogen peroxide? Hey, so no, hydrogen peroxide changes to water as soon as it releases oxygen. Once it releases its oxygen, the oxygen is what destroys the anaerobic organism that is causing you problems. And once you use that, the anaerobic agents create acid environment. Baking soda neutralizes that. Hydrogen peroxide kills the germs, kills the anaerobic with oxygen. What else do you want? Simple. You ask for simple, that's simple.
Fantastic. Thank you so much. But I have lots of questions. So I'll suggest, if we get, so we don't.
Can you group them together? Group them together. So
I'll try. I'll try to do that. But I have 2 hands raised. I'm going to honor those, if you don't mind, sir. Sure. Dr. Akintonde, go ahead. My darling bro, Daniel, unmute and ask your question, please. Thank you.
Thank you, Dr. Ajagbe, as usual. Fantastic presentation. You've opened my eyes again. Thank you. God bless you.
Welcome.
My question is in the chat box, but I'll still go ahead and present it verbally. So, okay. My question came before you made the last recommendation to use a combination of sodium, baking soda, and hydrogen peroxide. Maybe if you have mentioned that before my question, maybe I wouldn't have asked that question. But the question, let me say it again. If you have a persistent funny taste in your mouth, on the tongue, and the tongue is also whitish, and one has tried different toothpaste and toothbrush combination for weeks, and the taste remains persistent, what could be going on, and what kind of home remedy or over-the-counter medication one can use?
He also asked if this could be HPV. Human papillomavirus.
Mm-hmm. Okay, well, anything that has to do with the tongue. If your tongue is coated and you say you use the most expensive toothpaste, the most expensive toothbrush, but you do not touch your tongue, you just wasted your resources. The condition will still be there. Whether it is bad breath or bad taste or no taste. If it's coming because you have layers of dead tissue and food left over on your tongue that is blocking the taste buds, you will not taste the food. If you are sick and you have, maybe you are recovering from malaria or some other conditions that affect the taste perception, it doesn't matter how expensive your cleaning devices are, your taste bud is not going to be revived. But I challenge you, if you know that you've been having this and you've not been brushing your tongue, the first thing you must do is brush your tongue. Brush it as vigorously as you can. It's not going to go away. It's not going to bleed because you're brushing your tongue. One of the toughest parts of the body is the top surface of the tongue. If you bite it, you will bleed, but if you just brush it, it's not going to bleed. It's not going to get ulcer. It will open up the taste buds. The taste buds have been covered by things that prevent the thing you want to taste. Let's say sugar, for instance. If the sugar does not dissolve in water or saliva, and you put it on your tongue, you're not going to taste it. Anything you want to taste must be dissolved in saliva for you to taste it. All right? Whether it is sweet, sour, bitter, and salty, they must dissolve. Whatever it is you want to taste must dissolve in your saliva for you to taste it. All right? If you take solid fat, lard, or any kind of like Crisco's, and you put it on your tongue, you cannot taste anything because it does not dissolve in your saliva because it's lipid, it's fat. So please brush your tongue. That's number one. Number two, if you brushing your tongue does not improve your taste, use hydrogen peroxide and baking soda to brush your tongue.
Thank you so much, sir. Sister Kamsen.
Sorry, we didn't talk about the possibility of HPV and what to do.
HPV is not, sorry. Go ahead, sir.
Well, I mean, HPV, like any other virus, if it's superficial, if it's not infecting any cell, if let's say you have some dead cells with HPV on them, on your tongue, if you don't brush them off, they will remain there. If there's any opportunity for them to go into your tissue and infect the cells that are still alive, well, they can become spread like that. But if they are within dead cells, they are not as active as when they are in contact with living cells. So if you already have it on your tongue or you're thinking about your toothbrush, how quickly should you change your toothbrush because you're afraid of HPV? I wouldn't be worried about HPV from toothbrush. If you have a condition, for instance, if you have what we call there's an epithelial condition that it's in the mouth that is caused by HPV. For instance, I'm trying to remember the particular lesion that actually is directly related to HPV in our mouth. If you have that lesion and they did a biopsy and they confirm it, you cannot spread it just by brushing your tongue. I mean, it has to be within the tissue to spread.
Thank you so much. Sister Kamsin, go ahead, please.
Thank you, Dr. O, as usual. Thanks again for facilitating all these different, very informative sessions. Good evening, everybody. And thank you, Dr. Ajagbe. Thanks a lot for all the info. So my question today is, can you talk about the effect of chemotherapy or radiation for cancer patients on the hygiene of our teeth? What is the impact? And the reason I'm asking is because I have a personal experience. So I just want to make sure that I have the information correct.
Wow.
Okay, so usually before you go for cancer treatment, it is advisable that you go for a dental checkup. So we will look and see if there are teeth that need to be removed because they are rotten and they can make things worse. Because once your immune system is suppressed during the time of chemotherapy or radiation therapy, you may have flare of all these bacterial infections in the mouth. So if that is taken care of before the treatment, there should be no reason why you should be afraid that there will be a negative after effect, from taking chemotherapy or radiation therapy. But if nothing was done and everything was going in every direction, yes, there will be a lot of negative consequences as a result of lowered immunity, resulting from the chemotherapy and any other thing they use intentionally to suppress the immune system. So
is it true? Is it a fact that when a younger patient or a child, a person that had cancer or went through chemotherapy when they were young, would have more cases of cavities when they get older? Is there a correlation between both?
No, there is no direct correlation. The only time that there could be an association, but not direct correlation. It's like an association, like, oh, this child has Burkitt's lymphoma, and then they did radiation therapy apart from chemotherapy, and then they just shrink the tumor. Everything in the pathway of the radiation has taken some form of excitement from the radiation that goes through the soft tissue, particularly the salivary glands. So the salivary glands are potential areas where there will be side effects from radiation therapy. The reason is, once the salivary glands are affected negatively, they reduce their secretion in the mouth. And one of those things that it makes us not to have cavity just by just being alive is because we have saliva flowing in our mouth. The natural cleansing power of the saliva and the antibodies that are within the saliva kind of protects our mouth from spontaneous infection. Every one of us as I'm talking, air is going in my mouth. There are bacteria in the air going in my mouth, but they are not going to make me sick if I have healthy immune system. Mm-hmm. So if a child had radiation or chemotherapy early and it affects the salivary glands, yes, there will be a direct, kind of an association with increased incidence of cavity. And if they have dry mouth and they can't manage the dry mouth, for them, of course, it's going to affect the breath, the breath coming from their mouth, as well as the gum tissue will become easily irritated and inflamed and eventually become infected. And then they will have increased cavity incidence in their mouth as well.
Okay, great. Thank you so much. I appreciate it.
You're very welcome.
Excellent questions. Thank you. I'm sorry, this question I have to ask singly. I'm going to try to put things together, but Dr. Ajagbe, how do you get rid of side effects from medications causing dry mouth and odor?
Okay, well, medications that are causing dryness should be directed to the primary care physician. This medication is making my mouth dry. Is there any substitute? Is there any alternative to this medication that will do the same thing but will not make my mouth to dry up? If there is none, then there are artificial saliva. Different brands that are available that you can use to swish your mouth on a regular basis. They are artificial because the manufacturers try to mimic natural saliva, mimicking the pH, mimicking the wateriness, reducing the stickiness of the liquid. And they try very hard, but none of them is perfect. None of those artificial saliva is perfect, but they help, right? If somebody doesn't have the access to the artificial saliva, the next best thing to do is to have water to sip. Don't drink gulps of it. Just keep sipping water every few minutes. Just sip water. As you sipping water, you are cleaning your mouth. As you swigging it around your mouth, you are swallowing it. Anything that will deposit on your teeth and your tongue, you are swallowing. So if there is no way to change the medication, then artificial saliva should be looked into. If there is no access to artificial saliva, then water should do the job.
Thank you so much. Auntie Tawa, you have your hand raised, ma. Welcome, ma. Kindly unmute. Thank you.
Good evening, everyone.
Good evening.
My question is about toothpaste. On the side of the tub, there's color, yellow, blue. What does those colors mean? You know, the tub that we push on the toothpaste, when you take them from the carton, there's a color mark on the side, yellow, blue, all kind of colors.
Dr. Ajagbe, kindly unmute. Auntie Tawa, you mean on toothpaste? Is it a particular brand?
Well, I know that on Colgate, they have them. And I think it's all toothpaste. It's not just Colgate.
They have colors?
Colors, just like a dot.
Okay, so in the toothpaste itself, like they have strip?
No. I wish I have one. The top, there's a color on the side. Just a dot.
On the side of the toothpaste or on the box?
Not on the box, on the side of the toothpaste.
Mm.
Okay, well, what I can tell you about manufacturers, at least the little I know of Colgate Palmolive. Sorry, my battery is running low. What I know about Colgate Palmolive is that they have different batches, and then they have different constitutions of their toothpaste. So they use different means of coding to be able to identify the batch as well as the type of toothpaste they're doing. Not all of the toothpaste from a particular manufacturer are the same. They are all different variations of different constituents. Now, if you see those dots, the best thing is to see if you are in the store, if you see the two different toothpaste types, you can compare them and see why is one different from the other. Sometimes they use different packaging, different colors of the packaging, and then you can at least be able to decide which one of them do you want to take, depending on what your criteria may be for choosing the particular toothpaste brand.
Thank you.
You're welcome.
Thank you. So the question about the dryness of the mouth, I'm sorry, I got distracted a little bit here. That depends on the medication. Some medication cause dryness in itself, or in themselves. It will be important to discuss with the prescriber to see if the medication can be changed. That has nothing to do with brushing or the tooth health or mouth health. It's the medication side effect. And if it's not tolerable, then the medication needs to be changed. That's
Dr. O, if that persists.
Melody, just a minute, please. Melody, I've been muting you. Kindly keep yourself muted. Melody, please. Thank you. Go ahead, sir.
Okay. If the side effects of a medication keeps the mouth dry all the time, you can improve your condition by sipping water. That's what you have to do, the medication. But if you don't do anything, it can cause the teeth to start getting cavity. And like anything causing dry mouth, if the outcome of dryness of the mouth will be bad breath, will be cavity, will be gum disease, and eventually premature loss of teeth.
So, Dr. Ajagbe, a sister from Pennsylvania, Sister Kenitoinka, said, does bitter cola orugo help to prevent bad breath?
Absolutely. Bitter cola can do that because it has astringent in it. When it has tannic acid. When you chew bitter cola, the tannic acid actually causes your saliva, the sliminess of your saliva to coagulate. So your mouth will be will feel cleaner when you chew, bitter cola in between meals. In fact, when you chew it before a meal in the morning, first thing in the morning, and you rinse your mouth with hot water, your teeth will feel so clean. I mean, where you chewed it with will feel so clean if you use hot water to rinse your mouth afterwards.
Yeah, thank you.
Because it does have some pretty much like gum, some kind of some stickiness to it. You know, there's a content in it that is actually sticky. If you peel it and it's fresh and you tap it on the skin, I mean, after removing the skin, it's very sticky. So that you can rinse from your teeth with hot water and your teeth will feel clean.
So our pastor and attorney, Onigbide, said dental health is underappreciated by most people. This is why we find it hard to connect dental health to serious diseases. He has a question. Is it true that a dental disease can cause brain infection?
Yes.
Yeah, I think
absolutely.
So we should do that too.
Absolutely. Dental infection, particularly on the upper teeth. The upper teeth are close to the brain. You see, the upper jaw forms the floor. I mean, forms the nose, the lateral walls of the nose, and the next thing at the top of the upper jaw, above the nose, is what we call the cribriform plate. The cribriform plate is the separation between the frontal part of the brain and the roof of the nose. So it's so close. If anybody has a tooth infection that goes into the sinus and goes into the bone, spreads through the bone of the jaws, it goes straight to the brain. There is no intermission between that. So we tell people, don't wait until your infection is so bad on the upper jaw. It can still spread to the brain from the lower jaw, but it's not as direct as the upper jaw.
Okay. So, Dr. Ajagbe, while Dr. Buka, she has her hand raised, ask a question, kindly put your phone on charge so it doesn't die.
No, it's just a comment from what he made. As an intern at Harlem Hospital, we had a patient who had a abscess in the upper tooth, the eye, and we had to take her. She lost her eye. Wow. And it was on Christmas Day. I was on call, so there was a loss of eye, and that just brought it back to me. Just a comment.
So a dental infection caused her to affect her eye and lose the eye.
Yeah. Yes.
Okay. Let me help you with that. You see the back teeth. The last two teeth in the back have a direct connection to the part of the posterior wall of the orbit.
Okay.
So that's the molar and premolar. So, it has direct contact to
the last two molars even though part of it might be under the sinus, but what we call the retromolar area has a bone, spongy bone. You see, the bone is very spongy, not dense. When you have infection in that spongy bone, it spreads. It does not contain in one small space. It spreads very quickly. It can go. In fact, when somebody has a toothache, a tooth infection in the premolar molar area, it affects the inferior orbital area. Below the eye, you see it's puffy. If you don't do anything about it, the infection can spread directly into the floor of the orbit, in the floor where the eye is, and it can cause blindness.
Thank you so much for sharing that, Dr. Buka. This is what we're talking about. Oral health, dental health affects different areas of the body. So Sister Jones from South Carolina, how are you, Daisy? She said, this is very informative and so good. She said she grew up using baking soda to brush because of family economics, and she still does today. And she's grateful for this forum. I'm putting together all the baking soda, comments. Vinci said she can testify to that she tried the baking soda and peroxide, and her teeth is breathing well. I like that. It's breathing well. And that this segment, what you just said, Dr. Ajagbe, was from the last segment, which is true. Thank you. You remember, I remember that too, the baking soda and peroxide. Well, you see, so we remember, it's why it's repeated. So Tasha asked if a 7-year-old can use baking soda and hydrogen peroxide twice daily.
Well, sorry, one second.
Yeah. We can't hear you. We can't hear you yet.
Can you hear me now?
Yes. Nice.
Everyone can use baking soda and hydrogen peroxide. But caution must be taken, because 3% hydrogen peroxide may still be strong for a child. So you can dilute the hydrogen peroxide at 50-50. So it becomes, 1.5%. If you take 2 meals of 2 ounces of hydrogen peroxide, you take 2 ounces of water, you mix them together, and for a little child, that should be strong enough for their teeth.
Okay.
You don't want to use.
Do they have to do it twice a day? Or
they can do it twice a day. It doesn't have any negative effect. Yeah.
Okay. So I'm going to lump up these 2 questions. Auntie Susan Oshifade said she appreciates this teaching, but she has a concern with cavities. She said a concern with cavities is the drilling of the tooth. The thought of it sends her shivering. She says, can she still continue to manage her cavities with baking soda and hydrogen peroxide? That's one question. I want you to lump this into it. Dr. Fawale, a brand new doc, said, when do you suggest a visit to the dentist? Number 1. She also heard of people who went for regular cleaning and their teeth became highly sensitive and unable to drink cold water and must use Sensodyne toothpaste after that. So if you please address those 2, because the dental concerns, we all have that fear that dentists just drill, and it's not pleasant.
Okay, let me just say that if the fear of the drill keeps you away from the dentist, you should consider what would be the worst case scenario. The worst case scenario is that you will have to pull out the tooth. So which one will be much easier for you, the sound of the drill or the surgery to take out the tooth? I'm not saying it in a very insensitive way, but it's the reality of what it is. And I try to use a picture, expression by saying use a toothpick to smell the cavity, and then you will appreciate why you want to do something about it, because that's stench. Even if you are using baking soda and hydrogen peroxide, does not preclude you from having flares of infection in those teeth. And we already know if the infection can cause problem in your heart and the infection can cause problem in the brain, well, it's a choice, no doubt, but I think one should err on the side of caution than to be worried about the sound of a drill. Yes, there are dentists nowadays that don't even use the drill. They use different techniques to clean cavities. So you have to find out and say, do you have alternative to cavity, preparation? Or do you have any alternative to drilling? Can I come? Can you give me information about what to do to get my teeth fixed without going through the drilling? And if there is none, well, you have to bite the bullet. Just go for 30 minutes and the cavity, in fact, in most cases, within 5-10 minutes, the cavity is already cleaned. And then they just put the filling. So you don't have to sit down there for one whole day listening to the drill. But if you're already having 12 teeth that have cavity, of course, you have to sit as long as it would take for you to get those 12 teeth fixed. So that is what
if
I
you
would
go to the second question, please. The how often should one visit the dentist? And people who go to the dentist and then say that
come back with sensitive teeth. All right. So if you don't want to go on a regular basis as recommended, you can call it marketing. For a dentist, if you come twice a year, if all you pay the dentist is just the visit and cleaning, at least they make some money, right? But if you don't want to pay anything and you wait until you have an issue, you're definitely going to pay more money. There's no way you can dodge that. So prevention many times is cheaper than treatment. Particularly in dentistry. So if you can prevent losing your tooth, it will be cheaper and less intimidating than for you to want to replace your missing tooth with an implant. So it's an economic consideration that you have to make. Now, those who go to the dentist and come back and say, hey, I just went to the dentist. That's why I don't like to go. I came back, my teeth are hurting, are sensitive. Oh my gosh. Well, I don't think the dentist caused the sensitivity in the first place. If your gum is already receding and you didn't even know because it was covered by calculus, you have tartar buildup that is covered the root that has been exposed. Once they remove the calculus, there's nothing to cover that place, nothing. So you already have the calculus pushing away your gum, and now the root is exposed. There's nothing the dentist could do about it other than to tell you, I can put a filling to cover this for you, but you say, no, I don't want a filling. Well, the root is already exposed. There's nothing you can do, but the teeth will be sensitive. All right? Now, if you don't want to do Sensodyne, the dentist can do a filling around the neck and prevent the sensitivity long term. Let me just allay the fear. The dentist does not choose to make anybody's teeth sensitive. No. That our job as dentists is to prevent problems. If we come before the problem starts. But if you already have problems, we will have tools to correct the problems. That's why we're there. We want to help. We are not causing the pain. We are trying to alleviate the pain.
Thank you, sir. I am so sorry. Thank you very much, sir. Dr. Craig answered some of the, made suggestions about Dr. Daniel's question about the whitish tongue, that it could be fungal, it could be yeast infection, and that is true. And we see that in some disease entities that I don't want to go into right now. So it may be something that needs to be looked at. That is true. Thank you, Dr. Craig, for bringing that up. He also said that, hydration is important, and that for medication to be effective, it must be able to go into solution. Perhaps the illness that he was talking about is being exacerbated by the general underhydrated state that now cause the tongue to be whitish. Yes, that is true also.
That's true.
All are right on point. So, Sister Lola got the codes for the on the toothpaste. Blue is natural plus medicine. Green is all natural. Red is neutral plus chemicals, and black is all chemicals. This is very helpful. Thank you so much, Auntie Tawa. I never noticed these colors. I'm going to now look out, because anything that has chemicals, I'm going to stay away from personally, without even asking questions. I don't know what chemicals those will be, so I'm going to stay away from them. And thank you so much, Sister Lola, for educating us on those colors. I have a question that is very important, Dr. Ajagbe. We've been talking about hydrogen peroxide. This question says, or this comment and question says, at a training session, they were told that hydrogen peroxide should not be used in the mouth because it destroys both good and bad cells. That it was intended to be used in the preparation of corpses. Is this correct? Because we use it as oral rinse before procedures. We do in dental clinics. So the person is asking, is this correct that it is used in preparation of corpses and should not be used orally? What are your thoughts on this, sir?
Well, hydrogen peroxide was not designed for corpses. Hydrogen peroxide has oxidizing property. Because it's able to release oxygen, it's used primarily to control anaerobic organisms. And in the past, decubitus ulcers, non-healing ulcers that are infected and stinky because they are infected by anaerobic organisms, were all being cleansed by using hydrogen peroxide. So primarily it was being used in the externally. Now, if you use it in the corpse, if you found any corpse that has any fungating infection and you want to cleanse it, the easiest way to cleanse it will be to use hydrogen peroxide. So it's not primarily or solitarily designed to be used in preparing corpses. So, I mean, it is useful for whatever the chemical effect is on microorganisms. It controls, bacteria that actually do not survive in the presence of oxygen. So once hydrogen peroxide is exposed to organic tissue, whether plant or human, or animal tissue, it must foam. And the reason it foams is because it's reacting with the tissue to release oxygen. And the byproduct of that is oxygen and water. So water cannot be dangerous in the mouth. Once the oxygen has been released to destroy the organisms, the water is safe in the mouth. So
Oh, sorry. So while you're doing that, can you also speak on the controversy surrounding fluoridation?
Okay. Well, I mean, the controversy surrounding fluoridation will continue to be on because there are people who have on all sides, they have evidence based on whatever quality of research that have been documenting different effects of fluoride in human. One thing is very clear. We know that fluoride, if it is taken when teeth are being formed, the teeth that are being formed will become stronger and resistant to decay when they form because of what we call the fluoroapatite. The fluoroapatite, it's the apatite formed in the teeth, and in the bones, when they are being formed and they are being mineralized. When fluoride is incorporated in the apatite structure, it becomes resistant to acid dissolution. So the acid that destroys the enamel in the mouth will not be able to destroy teeth that are very rich in fluoride, incorporated in the teeth, not the one that you use once you already have the teeth and you have a lot in the toothpaste, in mouthwashes, in vitamins, and all of these things that people are now ingesting. That's different approach of using fluoride. Some people have associated fluoride use with all kinds of side effects. And there are people who believe that there's a conspiracy from the government by fluoridating the water to control people and all of that stuff. Well, I don't have any evidence to support or to refute any of this, but those controversies will always be there. But from structural standpoint, hydrogen peroxide used in children at the right amount, I think it's I want to say it's about 100 parts per million, or that's not too much. If you have that amount in the nutrition of a child, when the teeth are forming, the teeth will form very well and they will not be easily exposed to cavity.
Fantastic. We recommend it. It's recommended,
Excuse me.
And it has proven to do children well. I don't know about the controversies also, but people say a lot of things. Sister Edna says, how often is one supposed to go to the dentist if you have no problem with your teeth? Just routine check, regular check. We say that physical exam, you should go to your primary care doctor at least once a year. So she wants to know, how often should you go to the dentist for your routine care?
Well, if it's just for checkup and just to say, hey, check me, or do I have cavity that I didn't have last year? Well, it's best to do it at least once a year, if you can't do twice a year. Okay. It's better for you to get a good bill of health saying, oh yeah, your mouth is fine, or just get an encouragement. Oh, I've never seen any tooth this clean or any mouth this clean. That is encouraging to you. You maintain what you are doing. If I was your dentist, I'll tell you, keep it up. You're doing an excellent job. And I don't have to do anything. You don't have to do anything, spend any money if you don't need to. So I believe that.
So once or twice a year is
yes, once or twice a year is fine.
Thank you.
So those who are afraid that the dentist will find cavity that wasn't there, Well, I mean, if you're taking good care of your teeth and nothing has changed negatively, you shouldn't expect anything like that.
Actually, when you go to the dentist will let you know the next time you need to come also. So at least once a year. So Dr. Oduyebo. Oh, no, yeah, no. Okay, there's a question here that says, thank you for the comment and question that says, thank you very much for the resourceful and informative presentation. Your expert opinions are a huge wealth given for free. Thank you, Dr. Ajagbe. What are your thoughts about the charcoal toothpaste his son suggested to him? And a backup question, Sister Kinde just wrote, black is all chemicals, you know, from what Sister Lola found out on Google that those colors mean. She said she switched to black and two-toned black and white pastes because of the so-called charcoal in them. So comment, please.
Well, you know, it's funny because when we were growing up, I remember personally using charcoal to clean my teeth. Because somehow we gathered the fact that, oh yeah, it makes your teeth whiter. Well, charcoal is abrasive. If you are complaining about baking soda becoming abrasive on teeth, charcoal is more abrasive than baking soda. So if you use it, it's just, you're using it just because of the abrasive nature of the charcoal, nothing else. It doesn't have a chemical base for whitening teeth, but if you have gums that is stained black from the charcoal over time, guess what is going to happen? Your teeth will look apparently whiter. Not because they are whiter, but because the contrast has increased. Your gum is looking darker and your teeth are looking whiter. The charcoal in itself does not have bleaching effect on teeth.
Thank you. I hope that answers the question. So charcoal is good.
Well, it's good if you want to use it. It's just like I said earlier. If you know what you are cleaning, you decide what you're going to use to clean it.
Okay, so here we want to learn. You learned tonight that baking soda and peroxide is excellent. You taught us that. Is charcoal good?
Charcoal is not bad. Charcoal is abrasive. If you don't mind the abrasiveness of the charcoal, it will still keep your teeth clean.
Fantastic. So in pharmacy, there's a comment here that in pharmacy, charcoal is a universal health aid. So I've been trying to see if Haman is back from the UK. He has posted privately and openly that he has had difficulty staying on, connecting. So pardon, Dr. Ajagbe. He has some questions. I'll make sure that he gets answers to these questions. And once he came back, he was asking, you know, what the answers were to his question and if he could get the answer. Haman, yes, he's back. This is great. I've been trying. So Haman's first question, he says, yeah, can you please let him know the relationship of oxide for the general health in tandem with your oral health? Oxide, that's first one. Second one, it says, it will be good to have some fact sheet for this presentation and relationship with men's health in the private parts. Is that so? So oral health and men's health in the private part. And what is the effect of mercury fillings? 3 questions: oxide, mercury fillings, oral health, and male genital area. Thank you, sir.
This is loaded, though. Hey.
I saved you for the last. I'm glad Haman is back.
This is very loaded. Well, I'll take the last one first. If you look at, please remind me of the third one just now. I was about to talk about that.
Which one? Which should I start at the beginning?
Last question.
The last question. Oral health and male private part, male genital part.
And then there's another one you just said before.
Mercury.
Mercury. Okay, yes.
Mercury.
The mercury is what I was going to talk about first.
Okay.
That's another thing, another controversial topic, like fluoride. Some people are claiming that mercury in their feeling is causing them to have all kinds of nervous issue, from multiple sclerosis to, dementia and all kinds, and cancer and all of this stuff. Well, what we know from metallurgy is that mercury is liquid at normal temperature and pressure. When we say normal temperature and pressure, normal room temperature and pressure. However, if you increase the temperature a little bit, I'm talking about mercury by itself. Mercury by itself can become vaporized at high temperature. And when it is inhaled, when the vapor is inhaled, that is where we have the problem related to mercury poisoning. Now, we worry about mercury in the dental office, the way it is being handled. We do not like mercury to be spilled on the carpet. When mercury spills on the floor, it flows into cracks and it cannot be gathered again because it rolls into balls, and those balls roll away at top speed. You cannot gather mercury back. Even with vacuum cleaner, it's difficult to collect mercury. So when mercury spills and it vaporizes, it can cause problem to everyone, whether you have amalgam filling in your mouth or not, it's irrelevant. If you inhale mercury vapor, it's problem. It's problematic. It causes what we call acrodynia. So you have to be very careful with handling mercury under any circumstance. Don't let it escape. Don't let it vaporize, and keep it under water seal. If you keep it under water seal, mercury is safe. Now, as a dentist, when we use mercury, we use it as a part of an alloy. When mercury is mixed with zinc and cadmium and other metals, we can create an alloy that becomes hard. When mercury is mixed with other metal filings and becomes hard, it does not evaporate anymore. It has already reacted, it's already settled, it's stable. Once it's in an amalgam, you cannot vaporize it from the amalgam. Now, if you want to process it to extract mercury, it has to go to a factory to do that. You cannot do it just by having amalgam in your mouth and having mercury escaping into the brain. It is not true. It is wrong information, and it is erroneous, and it is misleading, and it causes confusion to the general public. Now, I do not understand the correlation between oral health and male health. I'm not sure if the person who is asking the question wants to expatiate on that, but if it's just the direct link that if you have gum disease, definitely you have impotence, I don't think there's any scientific connection to that. And maybe it's infection, like having orchitis or any kind of infection in the in the male genital area. I do not know of any research study that kind of links bad oral hygiene with male health issue.
Okay.
Now the other thing is
oxide is the third one.
The other thing about oxide is we use oxide in dentistry for cleaning, for polishing and things like that. But some people, I think some of the dental, toothpaste manufacturers use some oxides in their preparation. And it's also because it's abrasive. And so they can use it to
clean,
remove stains from teeth, just from the toothpaste.
Thank you. So, Dr. Okweyemi, yes, I'll ask you to please hold for a second. In follow-up of the question on amalgam, on mercury, there's a question that can the removal of amalgam filling cause the release of mercury in the atmosphere when it's being drilled out under high pressure?
No.
No, thank you. You taught me that before. I could answer that one. I remember
the reason for those who, sorry, Dr. O, yeah. for those who are not privy to the explanation of that, when we remove amalgam from people's mouths, let's say the filling is broken and we want to replace the filling, we use water stream. When we drilling the amalgam out, we don't drill it dry. We drill it with water flowing. Water jet flowing into the cavity with the filling being drilled out does not allow mercury to escape. And remember, just by drilling and filing the amalgam does not release mercury. Mercury has to chemically be extracted from the alloy, from the amalgam. It cannot be just by pounding it or grinding it, release mercury into the air. I can't hear you. Mute.
Sorry about that. Thank you. I said, Dr. Okweyemi should please give me a second. My brother, Mr. Doherty, said that he had been asked to take off his wisdom tooth, but refused to do it because they were going to put him to sleep. Is it okay to pull teeth without putting you to sleep?
Well, I mean,
you know why I laugh, Dr. Ajagbe? You should share my story.
Yeah. Mr. Doherty, this is just an advice. When anybody tells you, when it's another surgeon tells you they have to put you to sleep, it has to be based on two reasons. The first reason is you are scared of even local anesthesia. You see the needle, you are fainting, or you're just freaking out. Some patients cannot handle that. The moment they see the needle coming, they cannot sit still. They're not allowing you to numb it. And if you can't numb the tooth, you cannot take it out. So in such case, if it will be classified as a difficult case, you'll just be you'll have to be wheeled to the operating room and be put to sleep in order for the tooth to be removed. Another thing is if the tooth is in a very difficult to access location, and doing it while you are awake is going to cause you more trauma to get it out than relieve you of your pain, then the oral surgeon will definitely put you to sleep, because in that case you will not be struggling with trying to keep your mouth open. If a surgery is going to take too long, it is always advisable that the patient will be put to sleep. So if there is no impending complication and you are not scared of the needle and you don't have problem with getting numb, I think you should allow them to do it under local anesthesia.
So, sir, we'll chat offline. I'll fly to California to come be with you if you have to be under anesthesia. I'll be reading in the waiting area because you'll be fine. I think, the experts know what they're doing and they would have good reason to opt for that. I just wanted to say also.
That's our NAPAC boss. We'll all be there. 10 people will come.
Yes, Madam CEO will be there too. See?
Dr. V will be there. We'll all be there.
We'll all be there. So, Mr. Duarte, please schedule your appointment. We'll all be there.
Yes, you can count on me.
Yes. Sir, did you hear that? Schedule your appointment. We'll be there.
Well,
You'll be fine.
Loud and clear.
You'll be fine.
Well, the other thing I could suggest is if you have your X-ray, you can send it to me. I'll take a look and give you my opinion on that.
Thank you so much.
So to at least allay your fear. If there's something that is of major concern, I'll let you know.
Thank you.
Thank you, Dr. Ajagbe.
You're very welcome.
Thank you. So, Lynn Durand is a dentist by profession, and he's been asking these questions about mercury and stuff like that. It's just to satisfy curiosity. Well done as a doctor, asking questions that people usually wonder about and that needed to be asked. Thank you so much for your contribution, Dr. Durand. We're grateful. Thank you. So, Dr. Okpeyemi, that's another dentist. And guess what? Today is his birthday. I've been calling. I'll explain myself later, but happy birthday to you. Your family here on Medical Mondays wish you a very happy birthday and many more happy years. Thank you for participating, even all the way from Nigeria on your birthday.
Happy birthday.
Yes.
Happy birthday to you, Dr. Okpeyemi. Adewale.
Yeah, so you can go ahead and unmute. Yes, good. And
audible, please?
Yes, we can hear you, but it's faint. It's faint.
Okay, let me.
Am I audible now?
Yes.
Okay. All right. I would like to start by appreciating Dr. O for this wonderful opportunity. And then over time, we have been a lot of perspective on health has been brought on board. And I am particularly for the oral health aspects. And I want to appreciate Dr. Ajagbe for well elucidating clear presentation. I don't know what else can be, how simple it can be. Prof has made some of what the dental oral health jargons has simplified them. Well, however, I just want to make a comment, sir, with respect to one or two things. The issue of use of peroxide and bicarbonate, I know is a controversial, or some people, even among colleagues, we were using hydrogen peroxide before. When you do simple scaling and some other deep scaling, you want to use it, but over time, you just realize that it's no longer much of a practice. But I can tell you that with what the experience and what Prof has just shared tonight is cheaper in using those things, actually. I remember I saw a patient recently And I was mentioning to a colleague that I want to use the hydrogen peroxide. Everybody was just shouting at me that how will I be recommending hydrogen peroxide? Lo and behold, the patient, I used that for that patient, and the patient, we had a very fantastic results. So, in what I would just want to say in that aspect, in another thing is with respect to overdosages. I don't know, but Prof mentioned that there is no side effects. I know that the use of bicarbonate is abrasive. So for people to use it over and overuse, I would like Prof to speak to that because it can also cause sensitivity. Because most time when people get to hear about certain things that this thing works, most of the time overdosage is what is maybe the problem, not necessarily the material. That being said, the last thing I want to mention is on the issue of people with diabetic. The science has established a bi-directional relationship now with oral health and diabetes. And then the major thing about diabetes is this issue of sugar or glucose being available in the blood is not being used. And I could remember a case of a friend, a longtime friend that died as a result of a tooth extraction that was not properly removed, upper tooth that is related to the cavity between the oral cavity and the antrum. You know, the tooth was not properly removed. This guy was having pus coming out from his nose. You know, at times it comes from the mouth. They use a lot of antibiotics with no positive result. Until eventually, after he arranged to remove this tooth, you know, remove it's the part of the tooth, the root aspect of that tooth got broken as a result of that extraction. So he was looking for, at that time, was looking for people that can help him to solve that problem because it has resulted into infection. So what I'm trying to stress is that people with diabetics should try as much as possible to prevent infection because diabetes is is a dangerous disease that if not well managed, it can lead to something else. And this forum has provided a very opportunity for us to learn and key into many things. Although they said prevention is better than cure, but it's not necessarily what is not is cheaper, yes, but it's not selling. Most people will think it's not until you give somebody a product. Okay, use this. They don't believe that those things can be prevented. Lastly, the issue of our diets. I want to round up with that because what we eat more is what the bacteria feed on. The bacteria, and some of these bacteria, they like the refined sugar, and so also some other it encourages growth of some very virulent anaerobic bacteria, which will eventually lead to this disease. Having said all this, I would like to appreciate the Prof. Sir for this presentation. It's a very wonderful time being here. Thank you very much.
Happy birthday, Dr. Oluwole.
Thank you, sir. Thank you, sir.
Yeah.
Thank
Well,
you so much.
let me quickly address the things you raised up there. Hydrogen peroxide and baking soda. They are safe. You have already confirmed it. It's very cheap, and the expected outcomes are always excellent. This has been my experience. This is my 42nd year practicing dentistry. So it is not a
You look like
flippant.
you are 42 years old. How old are you?
I'm 19. So in my 42 years of practicing dentistry, I have seen all kinds of things, and I've worked closely with the dentifrice manufacturers. So I know whatever I'm sharing with deep conviction and with deep clarity of mind. When I say something about hydrogen peroxide and baking soda, I am not mincing words. The combination of the two is the safest that anybody could use to clean their mouths. Not only will it prevent virulent microorganisms that are anaerobic, that destroy every tissue. They destroy the hard tissue, they destroy the soft tissue. Not only will they do that, they also prevent odor, bad breath. They take care of bad breath. If somebody tells you you have bad breath and that is only because you have not been cleaning your mouth properly, use baking soda and hydrogen peroxide and test that person again. See if they will not tell you that, wow, what did you do? Your breath smells so good. That is how effective that combination can be. Then when you talk about other issues, infection spreading from a tooth, we just alluded to that somebody raised the question, can it spread to the brain? Yes, it can spread to any part of the head. In fact, it can travel infection from the upper jaw because of the membranous type of bones. The bone there is spongy. Infection spreads so rapidly and very diversely in the head. As soon as you get the infection into the soft bone, it's gone. If you don't control it quickly, the patient is going to succumb to that infection. If it doesn't go straight to the brain and kills the patient, it will eventually go into the bloodstream and end up in the heart and the kidney and the liver. So we got to bear that in mind. Every time, talking about diabetes, because it's a metabolic condition, it causes it has a major effect on healing. Anyone who has uncontrolled diabetes will have poor healing of every part of the body. And gum disease in a diabetic that is poorly controlled or uncontrolled will be refractory, which means they will not be easy to take care of. They don't heal easily. They don't heal very well until the diabetes is controlled. Thank you.
Thank you.
Can I make a comment?
Yes, please. Dr.
Buka. We talk so much about diabetes like it's the end of the world. There's a lot of medication now that we could use, and a lot of diabetics can be controlled. I am a diabetic, and I think I'm well, and I get my teeth cleaned every 6 months. But don't make it look like diabetes is the curse of death. Probably his friend was not controlled.
No, Dr. Ajagbe, she's right. She's right. Please let her land, please.
Yeah, it's not the curse of death. There's so much development in diabetes from way back. We don't do stick urine anymore. Like we used to have to do dipstick and all of that. Now we can measure it continuously with your L Libre. So he should have made sure his friend's diabetes was controlled. And if you go to the dentist often or you brush, things may be okay. But having pus in your mouth meant that, things had gone haywire for a while. Thank you.
Thank you. And thank you so much for that input. Dr. Ajagbe was right on the money. And so were you, Dr. Buka. Why are you both right? Dr. Ajagbe was talking about poorly controlled diabetes.
Yes, that's what I was going to say. Mm-hmm.
Today,
it's uncontrolled. That if it's uncontrolled, all bets are off. If it's uncontrolled, it's all bets are off.
Today, we have excellent, treatments for diabetes. Previously too, we did. People have to be compliant. People have to do the needful. Dr. Buka just told us, you need to go to the dentist once a year, seriously. She goes twice because, you know, she knows, she's controlling her diabetes, but then she still knows, you know what, I'm going to do the needful and do the preventive stuff. And you do that. The problem is most people do not do that. Most people we see in practice, we struggle. We educate, we beg that, you know, they change lifestyle, they take medication, they won't even take their medication. They have something against it. So you are both right on the money. I'm going to call on Auntie Tower to please comment. She has her hand raised. Auntie Tower. Auntie Tower, kindly unmute. Auntie Tower, kindly unmute. Okay, while she's doing.
Okay, yeah, sorry. Good evening, all. It's been an interesting topic, and I've enjoyed it all the way. I just want to seek an opinion, sir, Dr. Ajagbe, concerning the issue of pus coming out of the mouth as a result of, you know, poor extraction of the tooth.
Auntie Tower, I'll answer that question. It was not coming from the mouth. He actually said it was coming from the nose. He has diabetes. Something went wrong, and intervention was not done appropriately. He did say the extraction was done wrongly. It's impossible to be able to really address that. Even Dr. Opeyemi cannot, because he was not the dentist. It was not the doctor that did this.
No, I wasn't referring to, you know, I have a situation at hand. Actually, it's my mother. She, her tooth was not properly extracted, and that led to her having pus. She's been to several dentists back in Nigeria, in the UK, and it's the same situation. But our major concern is that she has pus coming out of the mouth, and she's seen several specialists. So we are just, and then we also realize that she's anemic. So we are suspecting probably the antibiotics that she's been taking due to that pus coming out of her mouth will have also, I'm not a doctor, so I cannot really say, but I believe that probably will have reduced you know, red blood corpuscles and, you know, things happening. So she's not in pain, but she still experiences the pus coming out of her mouth as a result of that, you know, tooth extraction that was done, which has not properly healed. She's been to several, you know, specialists in that area, and nothing has been resolved. She's presently in the UK as I'm talking, and they are still investigating what could be done. She's at the borderline of diabetes, and the doctors actually have been very concerned about the, you know, her being anemic. What will have caused that? So please, if you can speak to that, I would really appreciate it. I went to check her in the room. She's fast asleep. So I just said, let me ask on her behalf and see what we can do about that. Thank you.
Well,
thank you for your question, and thank you for looking out for her.
Yeah, that's a very sensitive question.
Should we take it offline? Let's take it offline, please.
Okay.
Can we do that?
Right. Sure. Why not? Yes, let's do it. Let's do it offline. Yeah.
Okay. So, Sister Mary here says that the colors on the toothpaste, that the color codes has nothing to do with charcoal. The codes are for toothpaste manufacturers to show contents of the products. So I thought so. That's why I said the one that has chemical, scrap it. I'm not using that one. So I'm going to start looking at my toothpaste. I'm going to now look at ingredients of toothpaste to make sure about that. Auntie Tawa, thank you again for asking that question and letting us know there are color codes on the toothpaste. So there's another question here. Can people with diabetes use hydrogen peroxide and baking soda? If so, how often? Thanks. Yes, they can. And it's the same way that it has been said. You can use it twice a day. You can use, diabetics can use baking soda and hydrogen peroxide just like anyone else. There's another question that says, what causes tonsil stones? How can it be treated, and is it related to any medical condition?
Yes, tonsil stones usually is formed when somebody has chronic tonsillar enlargement. And those who have chronic tonsillar enlargement, that is enlargement of their tonsils as a result of mouth breathing. The mouth breathing causes the secretion and the pus and everything to dry inside, at the opening where the collection is, because the way the air is passing by in a mouth breather causes those things to become dry. Over time, they become harder and harder and harder. That you can actually pick them up on X-ray. If you do an X-ray of that area, you can see tiny radio opacities. I mean, like tiny white specks within the tonsils. Usually, the ENT surgeons will manage that, and part of the things they do, if it's enlarged, they may do tonsillectomy, they may do complete tonsillectomy or partial tonsillectomy, which means they just take part of it off, depending on how big it is. But the bottom line is to reduce mouth breathing. If somebody has a blocked nose, because of developmental abnormality, and they do not manage that, to open the nostrils, there is nothing. Even if they do the surgery 10 times and they don't remove all the adenoids and tonsils, it will come back.
Thank you. So believe it or not, it's 9:30. I have a question. Is it now being said that baking soda plus hydrogen peroxide replace toothpaste? If so, what is dosage for everyday use? I wanted that question asked because, Dr. Ajagbe, you've addressed this before on this platform.
Yeah. Well, I mean, the way to do this is like any other. If I've replaced toothpaste with baking soda and hydrogen peroxide for 15 years, so it's not a question that I will have to scratch my head to figure it out for me. Now, if you are transitioning from routine toothpaste because you are brand loyal, like some people just say it's either Colgate or nothing else. If it's not Colgate, they're not touching it. Well, if you are brand loyal, it'll take you a long time to switch, to transition to baking soda and hydrogen peroxide. I can see such person, first of all, going from toothpaste to the one, then to switch to the one that has baking soda, and then switching to the Arm & Hammer and say this one is stronger, until they decide finally to use plain hydrogen peroxide and plain baking soda. And you'll find out, like Dr. Kweyemi has echoed, it is the cheapest approach. Cheapest. Very effective, but very cheap.
So, are there dangers associated with the tori bones in the mouth?
Tori.
Okay, tori bones in the mouth, and what causes growths?
All right. Well, this is moving in a different direction. But tori are excess bone that are, bone growth that you find in the mouth. You find it in the, usually on the roof of the mouth in the middle, It may be single or it may be two. It may be lobed or just smooth. You can find it also on the lower jaw, on the inside, just under the tongue, on the bone of the lower jaw. We found out from oral pathology that, or pathogenesis, that this is caused by clenching and grinding. That most people that have this have, what we call parafunctional habits. That is, they grind their teeth, whether they are awake or they are asleep, and some of them clench. They don't grind, but they always clench their jaws, as in when they are when they are concentrating on any task. You've seen people, you see them, the muscles of their temple is constantly moving. And you see them, sometimes you hear the crunching of the teeth, or the way the teeth is being slided across from each other. And so that causes the overproduction. That causes the overstimulation of the bone, the cortical bone of both the roof of the mouth and the inside of the lower jaw to form. Now you can also find similar, masses of bone on the outside of the jaw. We call that exostosis, and that is also related to grinding or other parafunctional habits.
Thank you. I hope that answers the question. So Dr. Akitonde asked, in preparation for tongue biopsy, how should one prepare for eating thereafter and minimize pain during recovery? So those will be handled by the surgeon, the person doing the biopsy. They're going to give you a written list of things to do before the biopsy, and instructions after biopsy. So don't worry about that. Follow instructions of the surgeon.
Absolutely.
And another question is, the epiglottis impacted by mouth breathing? I think that's a yes or no.
Well, epiglottis is what closes the airway when you're about to swallow. It prevents things from going into the airway. So when you swallow, if you are a mouth breather, the chances are that the epiglottis will be dry because the air is blowing into the lungs past the epiglottis. So it might be a little bit uncomfortable. The individual will have to be trying to clear their throat all the time. So mouth breathing negatively affects the epiglottis, just like any other structure in the back, in the oropharynx is affected by mouth breathing.
Thank you. So First Lady Judith asked a very important question. All the questions are important, but I love this one. She says, can you tell us how to use the baking soda and hydrogen peroxide? Should we wet the toothbrush with the hydrogen peroxide and then dip the wet toothbrush in the baking soda? I love it because it's important to know exactly how.
Well, yeah, that is one excellent way to use it. It's best to wet your toothbrush to pick up the baking soda. That way you don't have to be struggling to figure out how to put baking soda on your brush. Baking soda is very adherent once you have a wet environment. You can pick it up very easily and you can use it to brush before you use the hydrogen peroxide to rinse your mouth before you use water to finally rinse your mouth. Another way to do it is you can make a slurry of baking soda with hydrogen peroxide. Just take a few drops of hydrogen peroxide and put it with baking soda and make a small paste of that and pick it up with your toothbrush. And you can do it on the palm of your left hand. If you are left-handed, you make the paste on your right hand or your right palm and pick it up with your toothbrush, and you can use a toothbrush. You can make it as simply as you want, or you can make it as complicated. Some people might want to do in a fine dish and make a little paste and do tweezer to put it on their toothbrush. But it doesn't matter. As long as you get the baking soda on your toothbrush and you use it to clean your teeth and you use the hydrogen peroxide to rinse, all is well.
Oh, so you actually use the hydrogen peroxide to rinse after the concoction?
Yes, I use, okay, let me tell you how I do mine.
Okay.
It's not cast in stone, but you can vary it whichever way. I will rinse my toothbrush from the receptacle. When I take it out, I'll rinse it under the tap water. Use it to pick baking soda, all right? From a receptacle, I have a container with a baking soda. I'll pick it up. I don't put it in the whole box. Because if you buy a box of baking soda, don't start dipping your toothbrush in it. You know, I mean, because baking soda absorbs moisture from the air. You don't want it to become clumpy. That's why we put it in the refrigerator to absorb odor and moisture and all of that stuff in the fridge. So you don't want to expose your baking soda, packet to moisture as unnecessarily. So if you don't have a container to put it on the palm of your hand. Wet your toothbrush, pick it up from your hand. So the one in the box will be preserved. And so you just take what you need for this moment in particular. So once you do that, you can then use maybe 2 ounces of baking soda to swig. Just put it in your mouth and swish it around, after brushing. And then you spit it out. Don't swallow it because it's going to give you grief if you swallow the combination. So you don't do that. Just spit it out and then use water to rinse your mouth. Everything is fine.
Thank you. So, question, isn't a chewing stick superior to the toothpaste since it has tannin, which kills bacteria that causes plaque?
Well, tannin is basically an antioxidant, as well as what we call astringent. So if you use a chewing stick that has that, like, it will clean your teeth. But it is not the tannin itself that is cleaning your teeth. It's the mechanical agitation of the chewed stick that removes the plaque. That's what cleans your teeth. The tannin can help to prevent certain bacteria, but it does not clean your teeth. All right? So that doesn't make the toothpaste more effective than toothbrush. So if you do what we just talked about.
You mean you mean chewing stick?
Chewing stick doesn't make chewing stick.
Go ahead, sir.
It doesn't make the chewing stick more efficacious than toothbrush and paste. And the baking soda and hydrogen peroxide that we just talked about.
So people like us who like the baking soda and peroxide in toothpaste, is that okay? I think.
Well, if you use it properly, the goal is still one thing: to get rid of the bacteria in the plaque that causes problem. Right? So if mechanically you are using your toothbrush, even if you don't put anything on it, if you just use ordinary toothbrush, you're still going to get clean teeth.
No, but my question, we're talking about baking soda and peroxide.
I understand. I'm just trying to say that.
Is the toothpaste okay? Toothpaste.
Yes. All I'm trying to say is this: even if you don't use anything on your toothbrush, but mechanically you are using it effectively, you will still have the same result. Okay. But if you have a toothpaste you already made investment into, you already bought it, it has baking soda in it, and maybe they say it has peroxide in it, fine. I mean, continue using it until it's done. If you don't want to buy anymore.
After it's done, I'll buy more.
Okay, so if you like it,
yeah,
if you like it, just continue. Yes, just continue using it. Like I said,
so that's why I'm specifically asking, does it still have that baking soda and hydrogen peroxide? Am I still getting the same benefit?
Yes, you're still getting the same benefit.
Thank you.
But but you have, like you rightly deciding now, to check the labels.
Yes.
And so check the labels and see what else is contained in the toothpaste, and you decide. You can do the research on your own. What is the effect of this? What is the effect of that? Okay. If you see the side effects and you don't want it, then you decide against it.
Okay. So, Sister Lola, okay, wait a minute. Sister Faith says, will glass container be best for the baking powder, or it doesn't matter what container one uses?
Baking powder is different from baking soda. Mm-hmm. So don't use baking powder. Okay. Use baking soda. It doesn't matter what you use, glass or plastic or your arm. It doesn't change any of the structure of what you're using.
Okay. So it doesn't matter the container it's in.
Yes.
Okay. Mm-hmm. So question. What is causing death in some patients in dental office during surgery with anesthesia?
What is causing death?
Yes.
Well, I've not experienced any death in surgery, in dental surgery, and I've not experienced death even under general anesthesia of any of my patients or patients that I've been part of. So I wouldn't be able to tell you. Maybe Dr. Buka can from the anesthesiologist standpoint, because unless something directly cuts the major artery and is uncontrollable in dental surgery, I don't know what can cause death.
I know that before dental surgery, some of my patients come to me that the dentist will not do their surgery until their blood pressure is controlled. When they go in and their blood pressure is elevated, the dentist will not touch them. So
yeah, the reason we do that in dental surgery, when we monitor people's blood pressure, is because of controlled bleeding. If there's increased blood pressure, they have very high blood pressure, we would not be able to control the bleeding after surgery, and that is not acceptable. So if the blood pressure is controlled, we know definitely normal hemostasis will take place, and the bleeding after surgery will be controlled.
So in any surgery, not just dental, infection is a big one. Anytime anyone has any kind of surgery, we watch out for infection. So dentists do that even before. So for instance, if a tooth is infected, you may see a dentist say, you know what, take these antibiotics for 10 days before we even extract. They wouldn't even attempt extraction. So what I'm trying to say is that what I've seen so far, at least dentistry in the United States, dentists are very careful to look at things that are, systemic things that could potentially cause complication before they do put somebody under anesthesia, even local anesthesia to just remove tooth. They won't do it when they see.
Well, the reason we won't do that actually is because of the acidity. So when you have an infection and you inject into that area where you have the infection, because of the low pH, the acidity of that area, the anesthesia will not work. The local anesthetic agent will not work. That's one of the reasons why many people will say, oh, my dentist gave me 10 injections and I still had pain, and they couldn't still do the extraction. We normally will tell the patients to take antibiotics for 2 weeks and then come back, and then we'll do the extraction. That way we know definitely they're going to be numbed, when we're doing the extraction.
So the point I'm trying to make is that precautions are taken before surgical intervention, like any area of medicine. So anytime anybody is going to any surgery, let us know so we can be praying. The Lord God is still always in charge and in control. So I want to say thank you very much to Dr. Ajagbe and to everyone on this platform who has contributed and, just made this session again so robust, like all other sessions. Thank you so much. I have learned so much again tonight, although I'm going to keep my toothpaste if it doesn't have any bad thing, any chemical in the ingredients. But if it does, then I'm going to switch to the, real baking soda and hydrogen peroxide. My issue is time. I don't like to spend the time to pour this in my hand and then to,
No. Actually, Dr. O is the opposite. It does not take you 2 minutes to do all of this, including brushing, if you want to. But anyway, that's one-on-one. We can talk about that. Let's leave that in.
So thank you so very much for another wonderful Medical Mondays with Dr. O. And we look forward to next week. Be ready for next week because we're going to do some practical stuff that we all need to know about that are life-changing or could be life-saving, is what I should say, at the last minute of events. So, like I normally like to keep things quiet, look out for the invitation or the link next week to know what the subject will be. Until we meet then, please be safe. Coronavirus is again on the rise. I'm seeing a lot of positive patients, and so be safe. And the Lord
Thank you.
Thank you.
Thank you.